in. So if you come a little bit later, this is going to be recorded. If your colleagues were not able to make it, they'll be able to access this in the slide deck at a later time. And then we encourage you to use the chat feature or the Q&A feature to ask your questions throughout the call today. You are all muted besides the panelists, so we really do want you to utilize that chat feature to ask any questions that you have. So on the why track, I think most of the people on this call understand the importance about why this is urgent. So just a few sentences here. I mean, 2018, we saw an unprecedented amount of reports warning us that the time to take action was limited. We saw unbelievable extreme weather, hurricanes, wildfires, and flooding, and that all put hospitals on the front lines and really impacted the ability to deliver health care. But it's not just extreme weather. We're looking at a shifting disease burden. So depending on your geographic location, it's water and foodborne illnesses to mosquito and tick-borne diseases, extreme heat, and often an underrepresented health impact is mental health. And healthcare's response to all of these shifting disease burdens is going to have to be to adapt. And unfortunately, we're also part of the problem. In the US, it's estimated that healthcare is responsible for 10% of US greenhouse gas emissions. And this is a snapshot from our climate action playbook, and it really just visually represents and shows you where some of the impacts are found across the hospital. But this is why we're seeing action from health systems like we have today, both of which are on our Healthcare Climate Council, to many others who are stepping up and setting goals, taking action, because this is about patient and community health. So then if you're convinced already, you know, how do you begin tracking? And this really starts with drawing your organizational boundaries and the baseline year. Each of these sections were really set up in the toolkit. The first that I just reviewed, the why, to talk about the compelling research of how to do this. The second section, the how, goes into 17 pages of detail that you can check out, and I'll add the link into the chat after I'm done presenting. But we really walk you through step-by-step how to do this. So when you're looking at your organizational boundary, you're looking at, you know, what are your health system's accounting principles? What type of approach do you take? Is it equity or financial control or an operational control? And based on that, it can help you make some decisions about, do we include our hospitals, our outpatient facilities, our administrative facilities, where do leased facilities and leased fleet vehicles fall into? And then just like you do with any other sustainability goal, thinking about setting that baseline year. If you saw that second slide about the greenhouse gas toolkit, we had the opportunity to work with and obtain the Built on GHG protocol mark. So that organization really helped verify the information we put out, but also, you know, made some recommendations, this being one of them. So when you're looking at your baseline year, trying to find the earliest relevant time period with verifiable data for scopes 1 and 2. And this is important. You'll see just a small snapshot of examples of Practice Greenhealth members with these types of goals. It's important to understand what these goals mean. What do they encompass? So when we talk about scopes 1 and 2, we're really looking at, for scope 1, on-site energy, so any type of combustion of fuels on-site, mobile fuel combustion by fleet vehicles, refrigerants, waste anesthesia gas, and then for scope 2, all of your purchased electricity, any district steam, hot water, or chilled water. And then once we get to scope 3, we're really talking about everything else. Part of the way that we pulled this toolkit together was we brought a small group of health systems and hospitals that have been working on this for a while and are at varying points of their journey. One of the pieces of advice that we heard loud and clear from them, which I think is represented, seeing that all of their goals are really just about scope 1 and 2, is that scope 3 is just a very difficult animal to get our hands around. So if we're going to start tracking, let's do it in a limited way that makes sense. Let's find some limited areas of scope 3 to begin tracking, to begin identifying the data and understanding the formulas that we can use to track this. So within the toolkit, in that section 2, you're going to see that our recommendation is that you look at potentially 4 different areas. So meat procurement, disposal of waste, employee business travel, and employee commute. And the toolkit, again, walks you through where there are resources and how to calculate each of those formulas. I think it's important to note that 2 of those we also embedded into the award system this year. So on the food page, you have the opportunity to include if you track your meat purchase by category, we'll actually give you an estimation of your greenhouse gas emissions related to that meat procurement. And employee commute, we have some information in awards that's going to help you begin to track that. And then the toolkit gives some recommendations of how to actually convert that into emissions. But the message I want you to walk away with here is that we're really just talking about scopes 1 and 2, and that's just your on-site and purchased energy, your fleet vehicles, your anesthetic gases, and your refrigerants. So how do you obtain that data? Well, energy, there's a couple different ways. Energy Star Portfolio Manager, if this is something that you're utilizing in your health system, you can easily pull a report that's going to give you general categories around scope 1 and 2 emissions. With the release of the toolkit, we also provided a tracking spreadsheet, so a place where you can begin to store this information in your inventory. But I think the most exciting update that we were able to release this year is that by using the awards, if you give us your energy, your scope 1 and scope 2 energy, we'll convert that for you on the climate page. So you'll actually see, if you give us baseline, previous, and current year, we can show you what your emissions are for each of those 3 and do a comparison. We also, if you see it here, and I'll show it later, we also are doing the same for fleet vehicles and anesthetic gases. So to find that information, we have some resources through the Transportation Toolkit to help you identify which pieces of data you need to gather for your fleet vehicles. But you can also just be guided through the awards process that tells you which of those pieces of information we need to help calculate that footprint. And in the awards this year, we are doing that behind the scenes for you based on the data that you input. The same for anesthetic gases. We added this feature in 2017, and then this year we added the ability to give us baseline and previous year data based on your purchasing volume. And then again, behind the scenes, we calculate those emissions for you. And then lastly, refrigerants. This is a little bit more complicated. Again, in the toolkit, we outline how you can do this. The first option is to really work with your purchasing department to find that purchase data through invoices, find the relevant emissions factor depending on the refrigerant, and apply that. A second option, a Practice Greenhealth member shared an estimation methodology that's approved by both the Climate Registry and the GHG protocol, which helps to estimate your cooled space in square footage, your average refrigerants that you're using and emissions factors, and then a leakage rate associated with that. So there's a slightly easier methodology that, again, we can reference in the toolkit. And I think what I want to just say to wrap up this how to track piece before we move on to the next part of the toolkit is that this, while it's complicated, there's a lot of great tools that now exist to help you do this and make it much easier. Of course, if you're a Practice Greenhealth member, you also have the resource of your member engagement manager and people like me that you can reach out to with questions. So with that, I'm going to pass it over to John, who is going to talk to us about what his process was like for setting a goal at Cleveland Clinic. John?
Great. Thank you very much, Lauren. So about a little over a year ago at Cleveland Clinic, we announced a goal of becoming carbon neutral by 2027. And so I'm here to talk a bit about how we got to this point and what conversations we had, what steps we took, just sharing that with all of you. Cleveland Clinic is a $9 billion healthcare system. We now have 10 hospitals in Northeast Ohio, where the blue star is on this map, and 4 hospitals down in Florida, where the other star down is in Florida. Part of this climate journey depends on where you sit in the country. In Ohio, we sit in the middle of coal country. 10 years ago, 80% of our electricity came from coal. That's come down recently, but you see the black circles are coal plants. The orange ones, natural gas, pink is nuclear. So, part of this journey depends on where you sit and where you currently get your energy from. This is a chart that looks at the carbon intensity of electricity across the country. And on the left-hand scale is the amount of carbon per unit of energy, electricity, which is MMBTU. On the left-hand side is West Virginia, which has the most carbon-intensive power in the state. On the right-hand side is Washington, which is the greenest power, any state in the country. Ohio is 9th on this chart, and Florida is sort of in the middle. So, we sit with some of the more carbon-intense power. And beyond just sort of carbon intensity, there's a certain perspective and attitude towards coal in West Virginia that's probably different than that in Washington. So as you think about where your hospital system sits, where its energy comes from, where there might be people on the board of directors that represent energy sectors and things like that, it's just part of the picture of the, kind of the context of that your organization sits in, depending on where you sit geographically in the country. I ran across this recently. This is from a website called Solar Power Rocks, which is a pretty cool name, but it actually rates the sort of the friendliness of the state environment for solar power specifically. It's a little bit focused towards residential, but not entirely. But at the very top of this chart is New Jersey, which is the most solar-friendly state in the entire country. And projects there have a couple-year payback. You see Massachusetts, Rhode Island, as you sort of dial around, it actually rates them on 11 different factors of what makes solar power more feasible in those states. So for those of you that may not have looked at this intensively, and Mike's going to talk much more about this in New York with his example, but this might give you a quick indication of how renewable energy friendly the states that your hospital or hospitals sit in, which has an implication upon how easy it will be to do either on-site or off-site renewable energy, either on your hospital or in your state. So, in Ohio, we're sort of 22nd in the country, a grade of C. And if you look at the very bottom left-hand corner, the payback of doing a project at the moment is about 15 years with an internal rate of return of 6%. So that's okay. Solar systems last 25 years. It's just not the best at the moment in the country, but it's not the worst either. As I'll get to how this fits into our own story a bit later, but this is just a really nice tool for those of you who may not have looked deliberately at on-site opportunities in your hospitals. But at the Cleveland Clinic, we sort of have an integrated climate change strategy. This model comes from the IPCC. So we know that human interference is causing climate change, which in the middle is causing a variety of exposures, impacts, vulnerabilities. Lauren shared a couple nice charts around that. So at Clean Clinic, we really have three things that we're trying to do. The first is we're trying to, on the left-hand side, mitigate our own carbon footprint, reduce that. We're simultaneously trying to adapt to vulnerabilities. We're certainly most vulnerable in Florida, and so we've done some climate resilience planning down there. We're trying to advocate at the state and federal level for policies that will help improve this situation, and then also looking at clinical practices about how we're transforming our delivery of care in a new climate change world. But really, on our carbon neutral goal, sort of organize this as a stair step. About a little over 10 years ago now, we started really deliberately focusing on energy efficiency and started having success implementing what was at that time fluorescent lighting upgrades as a primary focus. In 2011, we signed up for the Better Building Challenge in partnership with the DOE and the EPA. We committed to a 20% efficiency improvement across our portfolio of buildings. In 2013, we worked with Robin Gunther and Health and Human Services on a climate resilience toolkit, auditing it and then implementing it. And we went to the White House in the following year and set a goal to make investments across our healthcare system in climate resilience because there's such a compelling need to make our hospitals as centers of community strength during these times of terrible storms and potential harm to our patients. We had increasing clinical engagement in 2015. Dr. Khatri, who's the chair of our Center for Asthma, and a number of other physicians have gotten more and more involved in this national conversation. As a member of the Climate Council in 2016 and 17, we worked with our government relations and made it clear that it was important and in our interests as providers of health to educate policymakers on climate change implications. So we went to Washington, D.C., along with a number of other health systems in 2017. And then actually in 2018, we've been very involved in the state level conversation around energy policy. So all this body of work and multiple conversations with a lot of people at the clinic at the C-suite level, and I'll detail a bit more of that, allowed us late 2017, again, just over a year ago, to say, hey, let's take the leap and set a carbon neutrality goal for our system. And so the way that I talk about this is, so we're not in the most renewable friendly region of the country. But we're not in the worst area either. So this is essentially implementing those different programs that were on the last slide, but also getting what I call climate hooks into different people at our senior leadership level. And so it sort of starts at the very basic mitigation, energy efficiency. There's a payback for that. You can engage caregivers in climate change, those that are interested. It's sort of an engagement hook. Climate resilience is its own compelling sort of business case. It allows to form new relationships, impact population health, kind of at the higher levels. Think about some of our leaders are concerned about transforming society and moving beyond their own personal needs. And I'll detail a bit what that looks like. But I think for anyone who's looking at a carbon neutral goal, it starts with this concept of mitigation, which is reducing our energy intensity. So this is a graph that shows progress from 2010 up until 2018. That shows that we're currently down about 17% on our energy usage. We have a 20% goal. We expect to achieve that hopefully later this year. But doing common sense things, turning equipment off, upgrading the efficiency of equipment, a variety of other energy conservation strategies has a huge payback. And over this time span has saved Cleveland Clinic about $50 million. So our CFO now, when we come with batches of projects, you said, what's the next step? We've sort of set an environment where we've proven out that investing in these types of projects makes a lot of sense. And ultimately, if the amount of energy our hospital system is less, then the task of offsetting that carbon footprint is lower as well. This is a picture of, we do an award ceremony for Practice, our Green Health Awards, which it comes back from CleanMed every year. This is a picture from that slide, and climate change and our energy goals and renewable conversations have been an amazing engagement tool for caregivers across our system. Climate resilience is another great engagement point. Our facilities manager, emergency management teams, and supply chain are sort of charged with ensuring that our hospital can operate through a variety of different extreme events, including climate events. So this shows how greenhouse gases lead to a variety of different weather outcomes: sea level rise, hot and cold spells, extreme weather events, hurricanes, droughts, wildfires, that ultimately we need to be prepared for. And we've committed, and through a variety of internal conversations, aligned our infrastructure investment to try to ensure that our hospitals are always online, 24/7, 365, that we're working with the community to ensure access for our patients during all types of weather events, and that our supply chain is able to deliver supplies to our hospital robustly throughout all different events. So this has been a really great engagement tool, and proving again that climate change is real, it's happening now, and this is why we need to engage in the societal level conversation on solving this problem. Another benefit for climate change engagement is just developing new relationships. So here I've sort of talked about the 4 buckets of work in climate mitigation, adaptation, advocacy, and this has really led us to new relationships, new partners that have allowed us to develop more innovative solutions in a variety of ways across our system, and has been a nice benefit of engaging in climate change work. Our clinicians talk about fossil fuels and the impact of health. This is a slide from the Lancet Commission on Health and Climate. And so we have a number of clinicians in our Respiratory Institute, our Heart Vascular Institute, or in our Medicine Institute that have talked about the very real health effects of climate change and fossil fuels, and the imperative. We've had physicians down in Columbus talking about the importance of switching to clean energy because of the mitigation of fossil fuels, which have a negative health burden on our patients. We've had another hook is just there's a couple people at our C-suite that are interested in kind of the societal transformation, and we have a very forward-thinking senior leader who's in the midst of our population health strategy, but he's very excited by the concept of just climate change engagement and carbon neutrality as our organization sort of being a leading force for societal change. I call this transpersonalism. There are some people that sort of see beyond their own individual needs and look collectively at the needs of the whole. This slide shows, this is a slide from a couple years ago now, but shows the relative carbon footprint of countries, shows healthcare contribution in the U.S. And it's notable that, U.S. healthcare on this chart is bigger than the carbon footprint of, say, the U.K. or Canada. I mean, U.S. healthcare is bigger than, I think, 12 or 13 different countries. So that's a pretty compelling call to action for us as a sector to take ownership of our emissions and reduce them. Moral obligation. When the Pope came out with his encyclical on climate change a couple years ago, I socialized that very directly with a number of C-suite members who I happen to know are of Catholic faith. And this concept of it's really in our moral obligation to take action on climate change was a very, very compelling one for several of our C-suite members. And, this is clearly an important one for Catholic systems, but there are people of that mind in any organization. And so this was a really important one for a number of senior leaders at Cleveland Clinic. And then, you know, it does afford the opportunity for recognition and to be seen as a leader. Very proud in that list of all the systems that are now, that Lauren shared, that have made goals. It's a chance to get out there and show that you're a forward-thinking healthcare organization that thinks about its patients first. These are just a couple examples. 2014, we had Gina McCarthy from the EPA here as she was launching her Clean Power Plan. The top right is our COO and myself went to the White House when the Resilience Toolkit was launched. In 2015, that's Dr. Khatri, one of our clinicians at a summit on the health and climate change at the White House. And she was actually recognized at the White House by a previous president in August of 2015. Things get a little crazy sometimes. So, you know, in these goals, finance is going to be a key player because as you're making these long-term goals, it may come up with what does this commitment actually mean to our organization? And at the clinic, our CEO, Toby Cosgrove, who served until about a year ago, was a forward-thinking person and didn't need as much of this type of detail, but it's certainly possible that in your organization's finance may say, hey, what does this commitment actually mean? And our finance organization asked this, and we went through multiple layers of iterations about the carbon neutrality goal. And, you know, I connected with some really great finance minds in our organization, which was very interesting and stimulating. But, you know, they said we needed to make a perpetuity assessment of the cost of carbon neutrality, which is, perpetuity is a long time. So what we actually did was create a 100-year model. It's called a Monte Carlo model, which takes a range of possible outcomes and allows you to use all of them to create a variety of simulate the future dynamically using multiple inputs that for us include the size of our organization, the energy intensity of our organization, the price of offsetting our carbon footprint, the fact that the green grid has gotten greener in the last 10 years and will likely to get greener in the future. We had to model wholesale and renewable energy pricing all at the same time over 100 years. Really fascinating process. It ultimately led to a much smaller number than finance, I think, was thinking it would be, which was really helpful in achieving our goal. And because we can't do renewable energy so dynamically on site, we're looking, one of the things that we showed is doing virtual power purchase agreements. We factored that into this cost, made the cost of carbon neutrality much less than our senior leadership thought, and was a big factor in our goal. So to summarize, these are the climate hooks. Mitigation, you know, you can save lots of money. From an engagement standpoint, you can attract the best workers with sustainability programs, and certainly climate is right at the top of that list. Resilience is adapting to the future to build relationships, impact population health, change society, be that change in the world, do the right thing, and ultimately help to lead the sector to a more climate-friendly future. So, you know, I think the lessons we learned, we got to make those personal connections. You want to lead with the right pitch, the right hook, be brave, build on successes, and be realistic. At one point, we sort of toyed with the concept of not investing in coal, and that just wasn't a starter for us, but ultimately we got to the carbon neutrality goal, which is the most important part of this for us. And timing matters. Our pitch came at the sort of end of our previous CEO's term, and just we had this base of work, and that allowed us to sort of take the leap. So timing certainly matters. So that's all I have, and I'm now ready to pass it on to Mike from Rochester.
Thanks, John. Just before we go there, I just want to underscore this last slide. So the pitch summary, John referred to them as hooks. This is also in the toolkit in section 3. And I just think that, you know, sometimes, as John just said, the timing matters. Sometimes you'll be at the right place at the right time and be able to get this going in months. And sometimes, as I've heard John say, it's hundreds or thousands of little conversations with these hooks with key stakeholders. So I just really love how he's able to outline what the different hooks could be and how you might, within your own institution, begin to formulate what that pitch looks like. So with that, I'm going to pass it over to Mike, and he's going to tell us a bit about their journey since setting a goal and how they're making progress.
All right. Well, thanks, Lauren, and thanks, John, for that overview. So I'm going to talk, give some more detail to some of the things that John mentioned. So maybe you might find yourself in this situation. I found myself in this situation in 2017 when we set a goal, and I was like, okay, great, now what do we do? So we set a goal that by 2025 we would source all of the electricity that we consume through renewable means. And when we pitched that to our leadership as the goal that we wanted to set, this is basically the plan that we outlined. In order to achieve that goal, there are really only 3 pathways to get there, and John mentioned all of them. You can reduce your energy use, produce renewable electricity, and then purchase renewable electricity or renewable energy certificates. And I think it's really a combination of all 3 of these things where it makes the most sense. So for our organization, we kind of did a rough estimate where we plan over this time period to reduce our energy use by around 35%. And that's really where you see the majority of the savings that you might get from trying to achieve this kind of goal. And then the next part is we plan on producing roughly 60% of all the electricity that we consume, build either wind or solar power to produce electricity. And we anticipate, at least in our area, if we build these in New York State, we'll actually save money doing so. And then there's always going to be a little bit of flex, whether you add some more square footage or you add a new MRI or several of them. There's always going to be some electricity that we need to account for, and so in those cases, we'll need to purchase some renewable energy. So if we just look over a timeline, this was our rough plan over that time period from 2017 to 2025. As you see, the brown power steadily goes down till it gets to 0 in 2025, and we anticipate every couple of years we're going to sign on to another renewable power purchase agreement or some other type of arrangement to either produce or purchase renewable energy. So I'm going to just dig into some details on each one of those categories. So path 1, reducing your energy. The first step to take in this is to really just set a target, whatever the number might be, over whatever time period you think makes the most sense. 10%, 15%, 25%. We spend a lot of time benchmarking our buildings and our organization as a whole, which is where we came to that pretty high number, but that's because our buildings are unfortunately very inefficient. And so what's great about all of these energy savings is they roll over year to year. And so we presented a range. If the electricity that we reduce is normally consumed in off-peak hours, then the savings are going to be quite a bit less than if that energy was consumed in on-peak hours, where the rates are quite a bit higher. So we presented that range, but at the end of the day, the overall savings are very, very substantial, which is probably the biggest selling point, at least for our leadership, was to see those dollar savings. And so kind of digging into this a little bit more deeply, when you think about reducing electricity, there are really only 3 areas in a building that consume electricity. There is lighting, heating and cooling systems, and then all the stuff that plugs in the walls. That's pretty much it. Everything can be categorized in one of those 3 areas. And so the solution for reducing electricity in all of those areas really just boils down to two things. Just turning things off when they're not in use, or utilizing more efficient technology. And so here is just a table of a bunch of different projects and kind of roughly what the percentage reduction you might see in a given building if you were to implement them across the entire building. So lighting is one of the biggest categories by just upgrading your lamps from fluorescent technology to LED lighting can save you anywhere from 10 to 15%. Depending on what type of building you have, it might be even more. It could be upwards of closer to 20%. But just upgrading those, just changing out light bulbs has a very significant value proposition. And the paybacks also can be, in some cases, almost instantaneous. And we see kind of on the long end 4 years, but most of the paybacks for those projects in our organization are right around 1.5 to 2 years. Optimizing chiller equipment. We've seen a lot of savings for several of our hospitals, and we're planning to do those types of projects at all of our larger locations. Optimizing building management systems, HVAC setbacks. Just to dig into one of these, OR, HVAC setbacks, that's basically, when our ORs, they're not used 24/7, but for many hospitals, and it's the case for ours, they're just on 24/7. So all the temperature settings and humidity settings, all of that are just constant. And so if you can set those back, you can save a pretty significant amount of energy by doing that. And I won't go dig into all of these. One that was pretty interesting for us was our vending machines. We actually plugged a meter onto one of our vending machines and realized that each vending machine costs anywhere about $500 to $600 a year just to stay on. When you multiply that across the entire organization, it's pretty significant. And so we asked our vending machine vendor if they could give us new equipment that has occupancy sensing built into it. And at the end of the day, we ended up saving somewhere around $60,000 a year just by upgrading just our vending machines. So let's see, let's move on here. So path to produce. In the renewable space, there are a lot of generators of electricity that are carbon free, but for renewables, it really kind of only boils down to solar and wind. And at the end of the day, you're trying to ask the question, okay, do we want to produce solar and wind on-site or off-site? And for most places, unless you have a lot of land available to you, off-site is the main answer to that if you actually want to build your own energy generating projects. And then after this, it pretty much just boils down to different financing options. So I put on here the 4, although they're all labeled as 1, but really, the 4 most common financing options, at least that I'm aware of. I'm sure there are others that are probably even more complicated than these, but I just thought it'd be helpful to walk through these. So the